At 2:15 p.m. on Tuesday, December 23, 2025, a sound like a plane hitting a house ripped through a suburb of Philadelphia. It was a catastrophic gas explosion at a 174-bed nursing home. But here is the deeper, more unsettling question. Was this truly a sudden, unforeseeable act of nature? Or did the investigation that began in the rubble the next day already have a paper trail? A paper trail of inspection reports, red flags, and critical decisions that predated the disaster. This tragic event exposes a critical, overlooked aspect of healthcare, the anatomy of safety. It goes far beyond a single facility. It connects a fatal explosion in Pennsylvania with the daily reality of specialized care in New York and Delaware. This is a story about vigilance, vulnerability, and how we choose to protect our most vulnerable citizens. Welcome to Health Inside, Anatomy and Science. Today, we're conducting a forensic analysis not of a body, but of a broken system. We're investigating the science of safety, the data of disaster, and what the tragedy at Silver Lake in Pennsylvania reveals about the urgent responsibility we all share. Part 1. The Anatomy of a Crisis, the Pennsylvania Tragedy. The timeline is critical and heartbreaking. Staff at the Bristol Health and Rehab Center, recently known as Silver Lake Healthcare Center, first smelled gas over the weekend before the explosion. A utility crew was on site responding to that odor at 2 p.m. on Tuesday, December 23rd. At approximately 2:15 p.m., a massive explosion occurred, causing a major structural collapse, killing at least 2 people, injuring at least 20, and leaving a scene of utter devastation for rescuers to comb through. The cause remains officially under investigation. However, preliminary findings point overwhelmingly to a gas leak. The real question for any scientist or investigator is why? Let's examine the predisposing factors, the risk factors that create a vulnerable environment. Just 2 months prior, in October 2025, the Pennsylvania Department of Health conducted a routine inspection. The findings, now public, are chilling in hindsight. The facility was cited for multiple fire and safety violations. These were not minor administrative errors. They included failing to provide accurate floor plans for first responders, failing to properly maintain stairways and fire extinguishers. A critical failure, the absence of required smoke barrier partitions on 2 floors. These partitions are not just drywall, they are a life-saving anatomical feature of a building. In a fire or explosion, they are designed to contain toxic smoke and fire, compartmentalizing the danger and creating precious minutes for escape and rescue. Their absence meant the facility's very architecture was compromised. Even more telling is the facility's publicly available Medicare.gov rating. At the time of the explosion, it was listed as much below average overall, with particularly poor ratings for health inspections. This data point existed in the public domain. It was a quantifiable measure of chronic issues. As one facility in New York's website states, they take on challenging cases which may lower our star rating. But in Pennsylvania, the low rating reflected documented failures in fundamental safety protocols. The explosion reveals a systemic vulnerability, a confluence of aging infrastructure, a potential gas line leak, documented lapses in safety maintenance, and a population of residents who are, by definition, physically or cognitively unable to evacuate quickly. Part 2. The Anatomy of Care, a comparative analysis of 2 other Silver Lakes. The name Silver Lake connects this tragedy to other unrelated facilities across the East Coast. By examining them, we can see the spectrum of what long-term care can and should be. 1. Silver Lake Specialized Care Center, Staten Island, New York. This 278-bed facility, family-owned since 1971, presents a fascinating contrast. It openly states it takes on the most challenging and highest acuity cases in New York State, including a pioneering award-winning ventilator unit for patients weaning off mechanical breathing support. Its leadership argues this high-acuity mission can negatively impact its government star rating, a 3-star or average rating from the Centers for Medicare and Medicaid Services. Let's dissect its clinical anatomy using U.S. News data derived from CMS.
Strengths, the vital signs. Its staffing levels are a standout. With nearly 3 hours and 40 minutes of total nurse staffing per resident day, it performs above average for short-term rehab and is rated high-performing for long-term care staffing. For its ventilator patients, this isn't a luxury, it's a medical necessity. Areas of concern, the pathologies. The data shows challenges. Only 31.8% of short-term rehab patients successfully return home, below state and national averages, and 40.5% of long-term residents show signs of depression, a rate significantly higher than benchmarks. This highlights the immense difficulty and emotional toll of caring for the sickest of the sick. 2. Complete care at Silver Lake, Dover, Delaware. This 120-bed facility represents a different model, one that has earned a U.S. News Best Nursing Home designation for long-term care and a 4 out of 5 overall rating. Its data tells a story of consistent, quality outcomes. Its health outcome metrics are strong. Over 51% of short-term rehab patients return home, meeting the national benchmark. Rates of rehospitalization, infection, and ER visits are at or better than expected levels. A key indicator, only 11.8% of residents are on antipsychotic medications, a rate significantly lower than the national average of 20.5%, and a strong proxy for the use of personalized behavioral care over chemical restraint. The takeaway is, the Dover facility demonstrates that safety is not just the absence of disaster, but the presence of consistent, high-quality processes that lead to good health outcomes. Part 3. The Science of Safety, from fire codes to human factors. So what is the actual science behind keeping a nursing home safe? It's a multi-layered defense system, and each layer failed in Pennsylvania. Layer 1, the physical plant, the skeleton and circulatory system. This includes gas lines, electrical systems, and structural integrity. The reported gas odor was a symptom of a failure in this layer. Regular, rigorous maintenance and immediate response to leaks are non-negotiable. Layer 2, the passive protections, the immune system. These are the built-in features that contain danger. The missing smoke barriers in Pennsylvania are a perfect example. Like firewalls in a ship, they are designed to stop the spread of a hazard, buying time. Their absence doomed the containment strategy. Layer 3, the active protections, the reflexes. Functioning fire alarms, sprinklers, and accessible, maintained fire extinguishers. Stairways must be clear, not storing paint buckets and bed frames under them, as was cited in Pennsylvania. These are the tools for immediate response. Layer 4, the human protocol, the brain. This is the critical layer. It includes accurate floor plans for firefighters, regular practiced evacuation drills tailored for non-ambulatory and dementia patients, a culture where a staff member smelling gas over the weekend triggers an immediate all-hands emergency response, not a dismissive assumption there was no heat in the room. The Pennsylvania tragedy shows a cascade failure, a potential physical plant leak, missing passive protections, compromised active protections, and a lapse in human protocol. The result was a catastrophic system-wide collapse. Part 4, the Vigilance Imperative, a guide for families and a public. In the wake of this, what can we do? How can we apply the tools of science and analysis to protect our own loved ones? This is your vigilance protocol. 1. Interrogate the data, the biopsy. Go to Medicare.gov's Care Compare tool. It is the national database. Look beyond the overall star rating. Drill into the health inspection report. Read the latest report. Look for patterns of citations, especially in fire safety, tag F000, and quality of care. Check U.S. News nursing home ratings for a data-driven breakdown of staffing and outcomes. 2. Conduct a sensory site visit, the physical exam. Your nose is a diagnostic tool. Does it smell clean or of urine, heavy disinfectant, or gas? Look for clutter. Are hallways and stairwells clear? Are fire extinguisher gauges in the green? Observe the staff. Do they interact calmly and respectfully with residents? Is there a sense of organized busyness or chaotic stress? 3. Ask the uncomfortable questions, the differential diagnosis. Can I see your most recent fire inspection report? How often do you conduct evacuation drills, and what is the plan for residents on the 3rd floor who can't walk? What is your staff-to-resident ratio on the night shift? The Staten Island facility's high staffing levels are a key metric to ask about.
4. Listen to the whispers, the early symptomology. Take every complaint from a resident or staff member seriously. The Pennsylvania gas smell was a whispered symptom that went unheeded. The explosion in Pennsylvania is not just a news story, it is a case study in preventable tragedy. It forces us to see nursing homes not just as places of care, but as complex life support systems. Their safety depends on the integrity of their physical anatomy, the robustness of their protective protocols, and the relentless vigilance of their human operators. The data existed, the warnings were there. The science of safety was already written in fire codes and inspection manuals. We must honor those lost by becoming better diagnosticians. We must learn to read the data, sense the environment, and demand the standards that turn a place of vulnerability into a place of true security. Because safety is not an accident, it is the most fundamental form of care. If this forensic breakdown of safety systems changed how you think about healthcare environments, please give this video a thumbs up. It tells YouTube this is critical public health education. Share it with anyone who has a loved one in or is considering long-term care. Subscribe to Health Inside, Anatomy and Science, and hit the bell. We dissect the systems that keep us alive so you can advocate for health in all its forms. Stay vigilant, ask questions, and demand safety.